You. February is American Heart Month, and as the coronavirus pandemic rages on, we're taking a closer look at the impact of COVID-19 on heart health this morning. We are joined by Dr. Cameron Hall, a cardiologist with Rochester Regional Health. Dr. Hall, good morning to you.
Good morning. Happy Heart Month.
Happy Heart Month to you as well. we're talking about a study from the Cleveland Clinic this morning, and some of the numbers are really surprising in terms of how many people are unaware that COVID can impact your heart. Let's start there if we can.
Sure. Although it's rare, I would say that the coronavirus mainly affects the respiratory system. In very rare instances, maybe less than 1%, we've seen direct effects of the virus on the heart itself. And so I would say that coronavirus is more of a respiratory disease, but in rare instances, it has affected the heart. I would say that patients with underlying heart disease are more prone to have adverse effects of the virus, and it is a risk factor for having a more severe illness with corona if you happen to contract it.
And that study found that people with pre-existing heart conditions are facing worsening health during this pandemic. Can you talk about the factors in that, and a lot of people perhaps delaying treatment or going to see the doctor for a regular checkup or screening?
Yeah, that's correct. Late in November, there was a survey out of Cleveland where they surveyed 1,000 people, 18 years and older, some of them with heart disease. And they found that people did exactly that. They were nervous about seeing their doctor. 50% of the time, patients reschedule their appointments. Almost in the heart disease world, 65% of patients rescheduled seeing their doctor because they were nervous about contracting the virus. What I would recommend is that despite the pandemic, that patients can continue to work on their risk factors and their heart health. They can continue to be active. They can be mindful of what they eat. And if they are symptomatic, to not be afraid to contact the doctor. We can still help you, and we can work with you to make sure that you remain healthy.
Talk about some of the symptoms and signs that people should not ignore and perhaps push off that checkup.
Yeah, I would say the more the typical symptoms of chest pain, shortness of breath, palpitations in the chest, uneasy feeling, dizziness, general unwell feeling. You should not hesitate to contact your doctor to help figure out what might be happening and get you the care that you need.
One of the other things I thought was noteworthy out of this study was 1 in 3 patients actually put off taking their medication, basically out of fear of having to go to the doctor. Maybe that was to re-up their prescription. But talk about the impacts of that, because that can be dangerous for your health if you're putting off taking your medication.
That is correct. And the details there, I don't know why patients were not taking them. It might be lack of refills, but we do know that the medicines we take in cardiac care really have a mortality benefit and really help patients remain symptom-free. So it is of utmost importance to continue your medical regimen. And if you are out of medications, you need to contact your doctor. We can prescribe that without a doctor's visit, and to make sure that your risk factors are well reduced. The medications we take in heart disease help reduce your risk of having another heart attack or heart problems. And so if that is the case, if you don't have medicines, please do not hesitate to contact your physician.
Yeah, Dr. Hall, appreciate your time. Good advice this morning, and a reminder for all of us, regardless of whether it's your heart health or any other issues with your health, don't delay those checkups and reach out to your doctor if you're not feeling well. Thank you so much.
Have a good day.